Hello and welcome to the webinar Real-World Evidence Study Voltaren, a diclofenac gel to treat musculoskeletal pain. My name is Anke Haas. I'm a senior scientist in the Medical Affairs Department of Haleon. Haleon, formerly GSK Consumer Healthcare, is a leading global consumer healthcare company with a successful corporate history spanning more than 160 years. Our mission is to improve the health of millions of people. Our popular brands include Voltaren. The topical treatment with NSAIDs like diclofenac for acute and chronic musculoskeletal pain is recommended as first-line treatment in various guidelines. For example, from the National Institute for Health and Care Excellence, NICE, EULA, the European Alliance of Associations for Rheumatology, and the Cochrane Institute. A systematic review from Oxford and Nottingham University researchers concludes that topical NSAIDs belong to the most effective treatment interventions in regards to satisfaction and pain reduction. Another systematic review published in Mayo Clinic Proceedings states that topical NSAIDs as being a good alternative for systemic painkillers as they offer the potential to provide the same pain relief while minimizing systemic adverse events and potential drug interactions. On the right-hand side, you find the results of the Global Pain Index. The Global Pain Index is a representative global assessment of the state of pain in the world. It is a social study already conducted for the fourth time, which captured the perceived impact of pain on individuals' everyday lives, their health, their feelings, motivations, and behaviors. It shows that around 50% of respondents had a substantial impact on their lives due to musculoskeletal pain, concerning not only physical aspects but also emotional, leading to reduced quality of life. Why are topical NSAIDs recommended in various guidelines and systematic reviews for acute and chronic pain conditions? Many clinical trials have proven its efficacy. To prove the efficacy of a drug, the study must take place under strictly controlled conditions to prevent distortion of the results. Therefore, to show the efficacy and safety of a drug, randomized controlled trials are essential. To enable comparable conditions between the wear arm and the placebo group, it excludes, for example, patients from study that have any other illnesses. Furthermore, the study participants must adhere to a strict study protocol as well as the recommendations for use. These experimental or so-called interventional type of studies have a very high internal validity. In contrast, real-world evidence studies belong to the group of observational studies. The advantage of this type of study is that there is no external influence on the use of the medicinal product, as well as on the individuals included into the study. Thus, real-world evidence studies complement the knowledge of RCTs by proving its external validity. Today, I would like to share with you the outcome of a recent real-world evidence study we have conducted with Voltaren Gel 1 and 2%. Professor Mayhöfner, a leading German expert in the field of neurology and pain with a broad expertise in real-world evidence studies, was instrumental in advising us on the methodology of this study. Aim of the study was to complement the efficacy and safety data from clinical trials by investigating the impact of topical diclofenac treatment on health-related quality of life. It is published open access in current medical research and opinion since August. This real-world evidence study consisted of two parts. First, a retrospective analysis, investigating patients' demographics and treatment patterns. Secondly, a prospective survey, investigating pain intensity, functional impairment, and treatment satisfaction. For the retrospective analysis, 95,000 pharmacy data sets, meaning 95,000 patients buying Voltaren Gel 1 or 2% for self-medication in German pharmacies during the one-year time period from March 2019 till February 2020 were analyzed. Let's have a look at the results. Mean age of the patient was 72 years. Around 2/3 were older than 65 years. With 70%, most patients had one dispensing only. Around 20% had 2 or 3 dispensings during the 12-month study duration. For the patients having at least 2 dispensings, the mean interval was 88 days. 77% did not switch to another topical treatment. Co-medication was quite common, with 74% of patients receiving cardiovascular medication, 35% receiving medication for gastrointestinal diseases, and around 30% received both medications. Less than 1% of patients combined topical with oral NSAID treatment. In the prospective longitudinal survey, the patient's journey was investigated via 3 consumer questionnaires, one at baseline, the second after 4 weeks, and a follow-up questionnaire in week 12. Patients were asked about pain severity, functional impairment, and treatment satisfaction. 467 patients were enrolled. Let's have a look at the results. With 60 years, the mean age was a bit lower than the retrospective analysis. Nearly half of the participants reported having underlying cardiovascular disease, like heart problems, high blood pressure. And 3.2% reported an underlying gastrointestinal disorder, like stomach or intestinal ulcers, bleeding from stomach or blood in stools. Participants reported purchasing diclofenac gel to treat pain such as body pains, not specific to arthritis, nearly 40%, back pain 23%, and arthritis pain 12%, while 24% purchased it for treating sports or accidental injuries. The following 4 slides show the outcomes of the prospective survey in more detail. Patient-reported pain decreased over time. The mean worst pain score of 6.0 on an 11-point numeric rating scale at baseline, indicating high moderate pain, decreased by -1.2 to week 12. This represents a clinically important change in pain severity. This diagram here shows the evaluation according to pain severity. 4 categories were distinguished: no pain, mild pain, moderate pain, and severe pain. To pick one example, let's have a look at the black bar. In week 4, 48.6% of patients who reported severe pain at baseline moved to a less severe pain category. At week 12, this proportion increased. 58.7% of patients who reported severe pain at baseline had moved to a less severe pain category. The number of functionally impaired patients decreased over the course of the study too. Patients rated the impairment of the following functional activities: daily activities, errands and chorus, physical activities, and social activities. The diagram here shows the proportion of participants reporting at least moderate pain interference with functional activities. To pick one example, let's have a look at physical activities. At baseline, 79.5% of participants reported at least moderate pain interference with physical activities. This proportion decreased to 54.5% participants at week 12. Participants were also asked whether they felt an improvement in their functional activities. To pick one example here too, let's have a look at errands and chorus. At week 4, 87.6% reported an improvement in errands and chorus. This proportion increased to 89.8% at week 12. More than 3/4 of participants were somewhat or extremely satisfied with diclofenac gel treatment. Most important reason for patient satisfaction was maintaining their social independence, meaning no need to ask for help or feeling in control. Other high-ranked reasons were ease of use and ability to carry out normal daily activities. To sum it up, for around 50% of patients, musculoskeletal pain has a substantial impact on health-related quality of life. Leading guidelines like EULAR recommend topical NSAIDs as first-line therapy for acute and chronic conditions. Real-world studies importantly contribute to the knowledge of a medicinal product as they investigate the impact of a treatment regime in real life. The recent real-world evidence study with Voltaren gel showed the impact diclofenac gel has on well-being and health-related quality of life and how it helps patients to regain control over their pain. Patients are mainly elderly with comorbidities. The broad majority is satisfied with the treatment, and pain relief leads to improvement in functional activities. This is of special importance in musculoskeletal pain as staying active supports the healing process. These new data from real life have emphasized the importance of diclofenac gel as a valuable treatment option, especially in vulnerable populations. Please find here the QR code to open access publication of this real-world evidence study in Current Medical Research and Opinion Journal, if you are interested to have a closer look again. In addition, I would like to share with you the QR code of our Haleon Health Partner Portal. We offer professional education, practical tools, and our awareness campaigns, like the recent Listen to Pain campaign in support of health professionals. Thanks a lot for your valuable time. Happy to take your questions.